Hello everyone, my name is Kelly Milburn and I would like to discuss COPD. What is COPD, you ask? COPD is a chronic obstructive pulmonary disease and can also be referred to as emphysema or chronic bronchitis. COPD is a lung disease, making breathing difficult. In order to understand this disease, it's important to understand the function of the lungs. When a person breathes air, it's traveling down the windpipe in the tubes called bronchial tubes. The bronchial tubes branch out into thousands of thinner tubes called the bronchioles, and then they end in smaller air-filled sacs called alveoli. The air fills up the elastic air sacs, aka the alveoles, and gas exchange occurs in the body, which completes a successful cycle of breathing. In patients with COPD, the elasticity of the air sacs is compromised, making it difficult to breathe comfortably because there's not a substantial amount of air making its way to the lungs. What can cause COPD? Cigarettes are the leading cause of COPD in the United States. Also, air pollutants, such as industrial construction sites, cigar smoke, secondhand smoke, fumes and dust, and in less than 1% of COPD cases, genetic disorders can be the cause as well. What tissues or organs does COPD affect? Not only do they affect the lungs, but they also affect the nerve cells and tissues, the brain, and the heart. The lungs are the major organ affected due to the destruction of the alveoles, but the nerve cells and tissues lack oxygen and it creates problems for the neurotransmitters. In the brain, because the neurotransmitters are compromised, information is not getting to the brain. And of course our hearts are affected because the lack of oxygen creates problems for our hearts, making it difficult to breathe. Next, I'd like to discuss which systems are affected by chronic obstructive pulmonary disease. The respiratory system, in that the trachea, the bronchi, and the lungs. The circulatory system, because of the lack of oxygen in blood cells. The skeletal system also, because you have difficulty performing simple tasks. Cardiovascular system, which is compromised of our hearts. And the endocrine system, which affects the thyroid, pituitary, and pancreas disorders. The signs and symptoms of COPD are shortness of breath. When you're performing simple tasks, a patient with COPD will find that it's difficult to keep up with their air supply. Constant coughing is also a sign because you're feeling the tightness of the chest and the mucus secretions. You also can get flu or cold-like symptoms such as the fever, the chills, and the body aches. Symptoms can also range from mild to severe or even unnoticed. You can also be easily fatigued, you wheeze, you have pursed lip breathing, a chronic cough, and in some cases, you can look thin in appearance, which is also a skeletal system effect. How can we prevent COPD? Although you can be educated about COPD, and you can know its risk factors and study the statistics, that's not always enough. You could also avoid smoking and avoid areas where other people are smoking to avoid secondhand smoke, but you can also wear masks in highly polluted areas. People usually in bigger cities, and even in restaurants, also wear masks. That way they protect themselves. The treatments for chronic obstructive pulmonary disease can be pulmonary rehabilitation, where the patient learns about the disease through educational classes with other COPD patients. Surgery can correct COPD. Clinical trials, where they test out new drugs and enforce the placebo effect, which is giving somebody what may be a sugar pill or a false experiment to see if they will heal themselves. Also, supplemental oxygen can help out as well, such as having oxygen tanks delivered to your home, and you can wear them on your back, you can roll them on the ground and take them wherever you go. That way you have a sufficient amount of oxygen. The consequences of COPD are shortness of breath, which relate back to respiratory issues, restricted activity, which are going back to skeletal problems, change in the quality of life. So if you have restricted activity and you go out for a family function, and let's say Easter egg hunting, and there's a lot of running around, well, maybe because of the shortness of breath, you won't be able to participate in activities like that, thus changing the quality of your life. Another few consequences are lung disorders, stroke, muscle weakness, and heart disease, which can lead to heart failure and especially high blood pressure. In conclusion, chronic obstructive pulmonary disease is a very common but deadly disease to have. Although many people are unaware of having this disease, there are still plenty that do know, and it's very important to be able to read the signs and symptoms of a patient who might be affected by COPD, and it's also important to be knowledgeable about treatments and preventions. Once a patient has this disease, it is then crucial to monitor the short and long-term consequences and thus refer back to treatments if they intend on living with the disease in comfort. I chose COPD because my mother has just been recently diagnosed with COPD, and although her symptoms are severe, unfortunately, the cause of COPD, which came from smoking cigarettes, has not stopped her, period. I hope to raise awareness in COPD patients, including my mom. That way we can try to end COPD once and for all. Thank you for listening to my video lecture of COPD, and I have enjoyed this class, and I hope to see you in the future. Take care.